Institute for Urban Indigenous Health provides household and social support services to help Aboriginal and Torres Strait Islander people aged 50 or over to keep their independence, improve their quality of life, and stay in their homes for longer. In 2017, majority of their new clients were self-referring. As can be seen in this graph, number of client registrations have been increasing constantly since 2014. IUIH provides help with a variety of services which includes transport, food preparation, personal hygiene care, nursing care, allied services, and many more. In the 2016-17 period, these services were delivered to approximately 1,200 elders. Now, over to the challenges and barriers for assessing these services. The main problems can be identified as the systematic problems such as racism and marginalization and appropriate number of indigenous health workforce. These systematic problems are compounded by poor communication within the health system. The problems associated with poor communication are exacerbated for Aboriginal and Torres Strait Islander people, largely as a result of the inability of healthcare workers to understand and acknowledge the cultural background of Aboriginal and Torres Strait Islander people. Moreover, a history of poor access to health services as well as the socio-economic disadvantage are likely to contribute to diminished levels of communication between healthcare workers and Aboriginal and Torres Strait Islander patients. The current scarcity of Indigenous health workers in most services adds a further layer of complexity to the challenges faced by Aboriginal and Torres Strait Islander people. However, this fact is a strength for IUIH as 61% of the home support staff identify themselves as being Aboriginal and or Torres Strait Islanders. Having the workforce helps removing the language barrier and making the service user-friendly. Now let's discuss a scenario which relates these challenges and barriers to how the home support service helps people make their life easier. Rachel, a 58-year-old lady, lived alone following the death of her partner. She did not go out much and was isolated. Since she had a high BMI, she found it difficult to clean her house or shop on her own. Her GP referred her to one of the offices for IUIH home support, and an IUIH regional assessor visited her to assess the ways in which the home support service could assist her with domestic household and overcome her social isolation. They connected Rachel to an aged care assessment team, resulting in Rachel being allocated to a level 3 home care package, which commenced immediately. This gave Rachel access to a high level of care, including mobility aid, personal care, continence aids, and meals. With these supports, Rachel was able to stay relatively independent, and community support workers noticed a change in her mobility, hygiene, and appearance very soon.
We have identified Australian policy and standards related to IUIH home support. In 2007, Close the Gap policy was made by the Council of Australian Governments in efforts to close the gap between Indigenous and non-Indigenous life expectancy by 2031. They set 6 targets to achieving this goal, which mostly concerns education and employment. With this came the Statement of Intent signed by Australian states in 2008 to commit to the aim of the policy. IUIH Home Support addresses and incorporates these policies and standards in numerous ways. They committed to numerous points such as the following. Mainly, all states had to commit to ensuring health services bridge the gap by adhering to health standards. As seen on the screen, IUIH delivers empowering care through their community-controlled services collaboration. They ensure full participation and include Aboriginal and Torres Strait Islander representatives in aspects of their care. They are very considerate of their health needs. IUIH respects this commitment by their continual expansion of services to accommodate demand in other areas around Brisbane and southeast Queensland. They provide comprehensive care through their thorough systematic model of care, which includes establishment, assessment, implementation, and transition. Through this, their care promotes and respects the rights of Aboriginal and Torres Strait Islander people.
After discussing the policies and standards related to closing the gap, now I'm going to talk about the best practice approaches for delivering services to IUIH clients. In the past, Aboriginal and Torres Strait Islander people have been subjected to colonization, discriminatory and racist policies by the early Australian government. They also experienced forced removal of Aboriginal and Torres Strait Islander children from their families, culture, and country. Hence, while delivering care to Aboriginal and Torres Strait Islanders, it is essential to consider these historical aspects to avoid the risk of prolonging colonization. That's it. In addition to considering those historical aspects, there are four main principles which form the core of best approach for service delivery in IUIH. These include accountability. While providing the IUIH services to Aboriginal and Torres Strait Islanders, it is essential for the health professionals to build a genuine relationship with the client. This can be achieved through respectful consultations, for example, regarding how they would want things to be done. It involves respecting Aboriginal and Torres Strait Islander people, their culture and spirituality, the strength and resilience with which they have preserved their family connections, communities, and culture. Hence, it is really important to take accountability. The second is holistic approach, which includes empowerment. In the present health system, health professionals are empowered. However, it is necessary that the professionals establish an environment where the client feels comfortable and is able to hold power. The control needs to be in the hands of the client for whom it is being done. There were a few critiques that were provided by the Aboriginal elders in a community aged care setting similar to IUIH, where they felt really disempowered and found lack of transparency. For example, one of the participants said, "They should tell us what people can have and ask us what we want. Some days I want cleaning and some days I want something else, but I don't know if I could choose." Another of the elders said that they don't ask us what we want, they just tell us. Therefore, by providing services to Aboriginal and Torres Strait Islanders, it is essential to involve them in decision making and be transparent about the kind and number of services that could be provided to them. Another approach is person centered care, which focuses on the assertion that the client's values are respected. It is also necessary to take into account the central importance of connection to family, kinship, community, and country. Another approach, communication. Effective communication forms another focus while providing services. Respectful ways of communicating, including body language, seating position, and use of certain words, may differ among communities and different regions. In some communities, for example, eye contact is considered as stirring and may make the person feel as though they're being judged. In addition to following these principles while providing care, it is essential to work in a culturally respectful and sensitive manner. All of these approaches are implemented considering the cultural safety of all clients.
From the information gathered about IUIH home support, relevant policies, and best practice approaches, we can make two recommendations about the best way forward for Aboriginal and Torres Strait Islander community health services in Brisbane. Firstly, we recommend that more funding be allocated to raising awareness among the Aboriginal and Torres Strait Islander people via campaigns around Brisbane about the facilities and resources they can access instead of getting informed by a GP. Secondly, we recommend more rigorous training and education model for health professionals towards cultural competency, making the medical, nursing, and health students culturally competent professionals by incorporating Indigenous health-related courses in the programs for services.